Hello, I'm Dr. Steele and welcome to my YouTube video. This is actually my very first YouTube video ever, so we'll see how it goes. My topic today is Prilosec and its cousins, the proton pump inhibitors, also known as the PPIs. I want to answer the question, are these medications safe and should you be worried about them and can you keep taking them? Just want to warn you, this is probably going to be the world's most boring YouTube video. There's not really any way to make Prilosec like a sexy topic. I'm a board-certified internal medicine physician. I'm currently practicing. So bottom line on these medications, which include Prilosec, Nexium, and Prevacid, and the prescription medications Protonix, Acifex, and Dexilant, I think these medications are generally safe, and but there are some concerns. So if you don't have to take them, it's probably better not to take them. On the other hand, if you do need to take them for a significant medical condition, I think you're going to be all right. And I think it's okay to go ahead and use them as prescribed. So the goal of this video is really just to supplement some of the conversations that I have in the office with my patients, to go over some additional information that maybe we didn't have time to talk about. This is the same advice I give my patients in the office. It's the same advice I give to my parents if they were asking me. So as far as why is this even a topic of conversation, I don't really know where my patients get their information from. It comes up quite a lot, so there must be something out there that's getting this word out about these. I looked on the internet actually and I found a YouTube video with a lawyer. I would not recommend getting my medical information from a lawyer on YouTube. As far as the why is there any concern these days, as far as I can tell, the two recent concerns are that there have been studies linking PPI use with dementia and PPI use with kidney failure. So that sounds very concerning. I did go back and try to find the articles that reported these associations. The article about dementia was just in JAMA, which is a very prestigious medical journal, just a couple months ago in April, I think. And the articles about kidney failure, there's actually several over the past several years. Looking at them, they're not terribly compelling studies, I have to say. They're what are called observational studies, which means they are studies that seek to show an association, but they can't prove causation. So just because they show there may be some kind of link doesn't mean that proton pump inhibitors are what cause dementia or what cause kidney failure. I know that sounds like I'm trying to pull a fast one on you and trick you into using PPIs based on technicality. But just to show you how that works, let's take Motrin for example. People use Motrin all the time. It's a very common medication. It also commonly causes heartburn or gastritis, stomach upset. So people often take Prilosec to help protect themselves from the side effects of Motrin. So therefore it stands to reason that if you took a group of people who are taking Prilosec, there's a good chance a lot of them are also taking Motrin. That's why they're taking Prilosec in the first place. Now, isn't it interesting that Motrin also causes kidney failure? So when you're doing this study, the question is, well, is the Prilosec really what's causing kidney failure? Or could it be that the reason it shows up in the study is because people who take Prilosec are also taking Motrin? I don't know if that's really, what's going on in the study, but that's just an example of how you can't assume that just because there's an association between Prilosec or the PPIs and kidney failure, that's what causes it. There could be another explanation. And that's just a general weakness of observational studies. The history of medicine in the last 20 years is absolutely littered with observational studies that, people got all excited because it showed this or that, either a good thing or a bad thing, but then better quality study later on basically disproved the observational study. That happens all the time. That being said, there are a few other concerns with the PPIs that we've known about for a while. They do likely raise your risk of osteoporosis because they interfere with absorption of calcium and magnesium. People who take PPIs are also more likely to get a nasty intestinal infection called Clostridium difficile, which manifests after you take antibiotics. So getting back to the PPIs and what to think about them overall, as I mentioned previously, I still think they're overall safe. And I think it's okay to take them if you have a good reason to. Like if you have something such as peptic ulcer disease or a history of bleeding from your stomach or something called Barrett's esophagus. There are enough studies about the kidney failure thing. If you are going to take these medications for a long period of time every day, I would probably ask your doctor if maybe you should have your kidneys monitored periodically. That being said, if it eventually is demonstrated that these medications actually do cause kidney problems, I think you're going to find that they're nowhere near as bad as Motrin and Aleve, which are already known to hurt the kidneys, and no one's really freaking out about those. On the other hand, if you have garden variety heartburn and are using Prilosec every day, you may want to rethink that strategy. It could turn out in a couple years that I'm a complete idiot and these medications actually do cause kidney failure and dementia. So it would be better to use another medication or just use the medications as needed instead of using them frequently. Zantac and Pepcid are in a completely different family of medications from the PPIs and do not have the same concerns. And as always, lifestyle changes are much preferable to taking pills. So if you can control your symptoms by doing things like just avoiding spicy foods, that would be a good way to go as well. Just want to emphasize, this information does not replace the advice of your doctor. This is meant, again, to be a supplement to that. Maybe give you some information you can take back and talk with them if you would like. But for crying out loud, do not go changing anything because of what I say here. That's not the intent. We hate it when people change their medications because of something they saw on the internet. That's like the worst. So don't do that. Well, I think that about does it for this topic in this video, so I hope you enjoyed my very first YouTube video. If you didn't enjoy it, I hope you at least found it informative, and if you didn't find it informative, I hope at least it doesn't make you want to kill yourself. You can always just, go to a different video if it's that bad. I hope to make more videos in the future, and until then, take care.